Back pain is one of the most common health problems. It affects almost 100% of population at some point in their life. And it is the leading cause of disability worldwide. That's why I will tell you top 7 causes of back pain and how to find out what's causing it and how to treat it properly. The first and most common cause of back pain is muscle or ligament strain. It happens when you suddenly lift a heavy object with poor posture. This pain is sharp or immediate, or it can happen from prolonged bending, twisting, or lifting. In such cases, the pain can be dull or worsened over time, even from being sedentary. For example, when you are a desk worker and then do yard work or gym sessions, it can cause muscle aches and tightness. The idea of muscle strain is that there is a physical overstretching, tearing, or micro trauma of paraspinal muscles or ligaments. This causes tiny tears in muscle fibers or connective tissue. The body reacts it with inflammation, leading to pain, muscle spasm, and stiffness. Pain is usually localized and non-radiating. It means it does not spread into legs. It's just back pain. It gets worse during bending, twisting, or prolonged sitting or standing. And it's relieved by rest, lying down, or heat applications. There is no numbness, weakness, or tingling. The first line treatment in this case is rest, ice, or heat therapy. In the first 48 hours, it's effective. From non-steroidal anti-inflammatory drugs, ibuprofen and naproxen reduce pain and inflammation and are commonly used. Also, topical analgesics like diclofenac gel are effective. Physical therapy is important, like early mobilization, stretching, and posture correction. Avoid prolonged bed rest, more than 2 days, as it may delay recovery. Also avoid lifting, bending, or twisting during acute pain. In such cases, imaging usually is not required. Only if pain lasts more than 6 weeks or if there are red flags like fever, trauma, or neurological signs. This pain can reoccur within 1 year, and it's a common scenario. The second most important cause of back pain is disc degeneration. It affects almost 25% of people with chronic low back pain. Main risk factors for degenerative disc disease are a sedentary lifestyle, repetitive heavy lifting, and genetic predisposition. In case of degenerative disc disease, there is gradual dehydration, thinning, and breakdown of intravertebral disc. These discs are gel-filled shock absorbers between the spine bones. Over time, due to genetics, aging, or constant trauma and compression, discs lose hydration and becomes less elastic. Disc space narrows and disc may crack, causing less cushioning, inflammation, or adjacent vertebrae, and small instability. Pain usually is mechanical from movement and sometimes also inflammatory. Pain is usually central part of the back. Sometimes people feel it in the buttocks or hips. Pain is intermittent, comes and goes over months or years. Stiffness in the back and joints also common, especially in the morning. Condition improves when lying down, when changing position or walking. Radiation into the leg is possible, but it's not usual scenario. No neurological signs occurs, like tingling or numbness. Typical scenarios are desk workers who are 45, working 8 hours plus, complains and dull pain, worse in the afternoon. The hallmark of degenerative changes is that pain worsens with sitting, improves with walking or lying down, and there are no nerve compression signs like numbness or tingling or weakness. There may be also feel like a grinding or locking sensation in the back. Imaging like MRI and CT scan usually shows disc height loss, disc dissection, drying out, and possible modic changes. Treatment includes physical therapy, ibuprofen, or naproxen, avoiding prolonged sitting and heavy lifting, using a standing desk, lumbar support, weight loss, and stretching programs. If a pain is severe or chronic, epidural steroid injections may help to reduce inflammation. Also, radiofrequency ablation can help to reduce facet joint or disc pain. Surgical fusion or disc replacement is reserved for severe cases. Most people live with intermittent pain and mandible flare-ups. Lumbar disc herniation is the third most common cause of back pain. We often call the symptoms sciatica. Symptoms are sharp burning or electric sensation starting in the lower back, going through the buttock and down one leg. Numbness and tingling is very common in this case, usually in the toes or calf. Lumbar disc herniation is when the inner girl, called the nucleus pulposus, pushes out through a tear in the outer disc, the annulus fibrosus, and compresses a spinal nerve root. This disc has a soft center and a taut outer ring. Heavy lifting, twisting, or disc degeneration can cause the outer ring to tear. The soft center bulges out, compresses the nerve, and causes inflammation and nerve compression. Symptom worsens with coughing or bending forward. Pain is usually relieved by lying down or standing upright. Right leg test is positive, which shows high probability of sciatica. For treatment, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are used most commonly. Activity is important, not full rest, but tolerated activity and physical therapy. McKinsey extension exercises are important. Sometimes oral corticosteroids are also used. If pain is severe and lasts more than 6 weeks, epidural steroid injections may help. Neuropathic agents like gabapentin or pregabalin are also possible. Surgery is required in only about 5% of cases. Usually when there is severe or progressive leg weakness or bladder or bowel dysfunction. Other causes also exist, like facet joint osteoarthritis, which is more common in people over 60 with a history of spinal wear. It's localized pain near the spine and worsens with twisting or standing too long. Morning stiffness is common. In rare cases, but still possible, spinal stenosis. It is also common over 60. More often in men, it causes pain, numbness, and weakness in the leg. It worsens with walking and is relieved by sitting or leaning forward. The sixth cause is sacroiliac joint dysfunction. This is more common in women, often postpartum or after pelvic trauma. Pain is near buttock or groin and worsens with standing too long. The seventh cause of back pain is vertebral slip. It's seen in teenagers, athletes, or older adults with degeneration. This is lower back stiffness, pain with standing or walking, and sometimes visible curvature of spine. It's more common in men.